As this pandemic continues, so does research into better understanding long haulers. People who were diagnosed with COVID-19 and now deal with long-term symptoms. Local 5's Mary Sugden spoke with a mother in Iowa who says her 16-year-old is battling an alarming lasting impact of the virus.
Yes, Samantha, Kristi Ladage says her 16-year-old was a healthy, vaccinated high school junior who tested positive for the virus back in September. She says his case was mild, but now weeks later, he's experiencing serious issues with his heart. Kristi says their hospital told them the volume of other kids experiencing these similar issues is so high, they might have to wait months for a certain test.
When Kristi Ladage's 16-year-old son Blake tested positive for COVID-19, she says initially she wasn't worried.
He had a couple days where he was coughing, but really that was the extent of it. No fever.
Now, 5 weeks later, this mom's worry is through the roof.
He has inflammation of his heart muscle as a result of COVID-19.
Kristi says Blake started to have significant chest pain weeks after his diagnosis. A quick trip to the doctor turned into a referral to pediatric cardiology in Iowa City. While the doctor was able to give an initial diagnosis, an MRI is needed to give a full picture. But there's a problem.
When he told me it would be, at least 2 months, potentially longer, before we could have that cardiac MRI done. And the reason he gave was because there are so many kids with cardiac complications after COVID in Iowa right now that's what the wait time has become for this procedure.
The Mayo Clinic, which is actively studying long-haul symptoms, says its research shows 10 to 30% of people diagnosed with COVID-19 end up with these lingering symptoms. The health system says it's just starting to scratch the surface of learning why these lasting symptoms happen.
Let's not focus so much on trying to cure this right now, but giving patients all of the skills and strategies they need to manage these symptoms so they can stay in control of their condition.
So for now, Kristi anxiously awaits her son's turn for more testing, making sure they follow the doctor's orders to take it easy for fear of the worst.
If there's inflammation in the heart muscle and there's exertion like that then increases the likelihood of life-threatening arrhythmias that can just cause the heart to stop.
And Kristi says her son is wearing something called a Holter monitor. It's basically going to track his heart rhythm and analyze that for doctors, but it's also going to alert the family if his heart dips to a dangerous rhythm.
Mary, we know that Blake was vaccinated. So what do we know about the long haulers, populations who've had the vaccine? What about the symptoms? What have we learned from that?
So we learned from doctors, especially those ones at Mayo Clinic who are doing a lot of this studies. They say this can happen, but they stress it is extremely rare. So their message to people potentially experiencing these long haul symptoms is to seek medical care. Even though the research is kind of in the initial stages, they still say you shouldn't let something this serious just basically go to the wayside.
All right, Mary, thank you.